Welcome back to MedTech Insights. Today, we will be previewing a can't-miss panel session that will be one of the highlights of the conference agenda at our upcoming event, MedTech Expo. The session, titled Beyond Price, How Value-Based Procurement is Reshaping NHS MedTech, will be chaired by Chris Whitehouse, Director of Whitehouse Communications, who has been pushing for value-based procurement for many years. He will be joined by David Lawson from the Department of Health and Social Care, Ismail Hanif from Essity, and Member of the House of Lords, the Right Honourable Lord Hunt of King's Heath. I'm joined today by Chris to give some insight into this session and why you should attend. Chris, first of all, can you give a quick preview of what you'll be discussing in the panel session?
Well, this is a very exciting session because for the first time, the NHS is going to adopt a system-wide policy when it comes to buying medical devices of looking beyond the item price. In other words, it's not just the price of the item that matters. Indeed, what matters most is that it's the right product for the right circumstance for the right patient, and that what the NHS is buying will improve the patient outcome. We're challenging the assumption that what is cheapest is best, because in medical technology, it's hardly likely that cheapest will be best. So we need to find the most appropriate product for that particular patient, and that particular clinician should have access to it.
And who will benefit the most from attending?
Well, certainly anybody trying to understand this new approach to procurement in the NHS, whether that be NHS procurement or clinicians themselves. But in terms of those attending MedTech Expo, anybody who wants to sell their medical device or consumable product into the NHS in England needs to understand the new approach, the new methodology, and how their product will be scored and assessed when they're trying to justify the price that they want to ask for it. It's a whole new approach. The NHS has been around, as we all know, for nearly 80 years. And until now, it's been buying, in many situations, largely on the basis of who charges the lowest price for their product. In future, price will account for no more than 40% of the score that you can get for your product. The other 60%, as a minimum, will go on the impact that it has on the patient, on NHS budgets, on clinicians, and indeed on the environment. A proper assessment of its true value, just as you wouldn't go into an electrical goods store and say, I want your cheapest washing machine. You would tell them what capacity you wanted, whether it would have a built-in tumble dryer, whether it would run on both hot and cold water or just one alone. All these items you would take into account, including its energy efficiency, the volume of water it uses, and its environmental impact. So for the first time, the NHS is going to be assessing MedTech devices on that basis.
You've been one of the biggest voices pushing value-based procurement, and you're my go-to expert on the topic. If you had to pick one key takeaway that you want attendees to leave with, what would it be?
This is going to be a paradigm shift in the way NHS procures your products. So you must engage with it. You must get up to speed, and you need to have evidence to back up your claims. If you're going to say that your medical device will reduce the number of times a patient needs to be seen and reduce the number of adverse side effects that they have, then you'll need evidence and case studies to back that up. At this session, you will find out what a good case study looks like.
This session will be taking place from 10 o'clock till 11:30 on day 2 of the show on the Insight stage. And thank you very much for your time today, Chris, previewing the session, and I'll see you on the 4th of June.
Look forward to it.